Welcome to AFMC TV. I'm Robin Ledbetter.
The goal of that is to maximize people's quality of life, right?
You want to make sure that your housing is affordable in your community.
We have to think about vaccines in a way that we haven't thought about them before.
I had a lot of the legislative adults to were very creative.
Down on the floor and play with their kids.
AFMC TV, thanks for watching and have a great day. Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Keesa Smith-Brantley, and she is the Executive Director of Arkansas Advocates for Children and Families. Keesa, thanks so much for being here again.
Absolutely. I love every time I can come back.
Me too. So your organization focuses on how policy shapes outcomes for children and families. Tell us why this is such a critical moment for Arkansas.
So there's just a lot of changes happening right now. And, sometimes I think, with children, it used to be that we could always agree, no matter what side of the aisle you were on, we could agree that we need to make an investment in children. And what we've seen really for the past, 5 to 6 years in Arkansas is that we don't have that same focus on how to improve the lives of children, how to make the investments for children that we need to make. And so it really is critical, especially as we see a lot of changes happening on the federal level that coincide with decisions that we've made here in the state.
So when you look at the current landscape, how would you describe the overall state of Arkansas for child and family well-being?
Well, it's interesting that you asked that question because our organization just released the Kids Count data. So that's a partnership that we have with the Annie Casey program that specifically looks at child well-being, right? So it's right on point with what we're discussing today. And so we always, this report always ranks states based on how well they're doing and how well children are doing. And we tend to be at the bottom. And unfortunately, there was no change this year in terms of us being on the bottom. We are 43rd this year. They encourage us not to compare from year to year. We were 45 last year. Some people look at that as an improvement. But in some of the data, we really did take, unfortunately, a dive in terms of how well we were doing in areas.
What are the areas? What does that look like that puts us 43rd?
Yeah, so the big things, Kids Count looks at 16 different indicators, but the big four that we call them are health, education, economic well-being, and family and communities. And so on the economic side, we did a little bit better because there's more parents that have either their high school diploma or their GED. So Arkansas did see an increase in that. There's a number of families where they now have a parent that has stable employment. So that's a positive to look at. But unfortunately, on the flip side, because housing costs are going up, because food costs are going up, even though those indicators say we're doing better, families do not feel like they're doing better. And that was the area that we improved in. So unfortunately, the areas that we're doing poorly in is that we had a significant drop in the health side because we've almost doubled the number of children that are uninsured in the state, which is a big problem, obviously. And then on the education side, we've increased in the number of children that are ages 3 and 4 that are not in any type of school setting or receiving any type of early childhood education. So unfortunately, we're going backwards.
So one major issue too is postpartum.
Yeah.
And Medicaid coverage in Arkansas is currently the only state without a full 12-month extension. So what does that mean for maternal health care and infant outcomes?
I think the last time you and I talked, we were one of 2 states. And then Wisconsin did what we did not do and made their postpartum coverage 12 months. And so, we're talking about all of the changes that are happening in Arkansas. We're still one of the highest for the rate of maternal mortality, and we're still one of the highest for infant mortality. So the fact that we haven't done this one tool that will help encourage women to go to the doctor because they have insurance coverage. If you don't have insurance coverage, you're not trying to figure out how to go to the doctor because that's a big cost, right? So that's significant. The fact that we talk about 12 months postpartum, but there's also additional issues pertaining to maternal care, which is just the ability to even find an OBGYN that is practicing in your area. We're seeing that decrease. So there's, don't want to be too negative, but there's a lot of things that 12 months postpartum can help. I do encourage people when we're talking about that tool is that it is just one additional tool that the state of Arkansas needs to do. It will not cure our maternal health crisis, but it will help with women feeling like they don't have to worry about getting a big, huge bill after they do what we want them to do, which is to take care of themselves and their baby.
And so we're also seeing shifts in Medicaid enrollment and coverage retention. How are those changes affecting access to care across the state?
Yeah, so, we've already started to see some of the changes in terms of individuals not being covered. We just talked about the fact that we have more children that are uninsured. But soon, starting soon, there's going to be major changes to the Medicaid program. So I know I don't have to tell anyone working at AFMC that we're soon, due to the One Big Beautiful Bill, going to see work requirements nationwide. In Arkansas, we saw work requirements several years back. We were one of the, we were the first state to do that. And we saw people lose coverage. And unfortunately, we saw people lose coverage that were still entitled to coverage. And that's the biggest concern. So, there's a lot of conversations happening with DHS right now to try to determine how they're going to roll out this program because, very soon, it's going to be a requirement. And there were just some big rules that just came out just last week about medical frailty. And, we're kind of getting into the weeds, but that is going to be a tough thing because we used to be able to look at someone's condition and say, you have this condition, we're going to classify you as medically frail. And now the process to be ensure that you qualify as medically frail is going to be more complicated. So there's a lot of us waiting to see what DHS has to say about this new process because it's not just cut and dry.
And programs like SNAP, also facing new requirements that could also impact food security. How do these non-medical factors directly affect health outcomes?
Yeah. So, whenever I talk, I try not to talk about all of the bad things that are happening, in Arkansas in terms of where we rank. But you've hit the nail on the head, which is that we historically have had poor, specifically health outcomes. And we all know that food can equally be viewed as medicine. And so if you live in an area where you have limited access to food, or you're financially limited, then that's just going to exacerbate where you are health-wise. If I am someone who's trying to, that has illnesses, if all of my food is processed because the closest, a place that I can get food is a Dollar General, then that's not going to be best for me in the long run. So, there's so many things, and SNAP is, as you said, changing. There will soon be a requirement that the state pay for a larger portion of our administrative costs, and soon there'll be a requirement that the state put up funding for equally the cost of the benefits, a portion of that share. So there's a lot of new complicating factors that the state is going to have to address, or we risk, people potentially losing a program that helps them access food.
And from the healthcare provider perspective, how are these policy changes showing up in clinics, hospitals, and communities?
Yeah, so people are coming in sicker, right? They're losing the ability to really get the preventive care that they need. And so individuals are going to the hospital or going to the doctor when they don't have a choice otherwise, right? Which is problematic. We want people to be able to go see their doctor with some type of regularity just to make sure everything's, working right. I joke, I'm getting a little bit older, so I need I call it a checkup, right? Like I need someone to make sure everything's doing what it's supposed to do.
Preventive care is important.
Absolutely, absolutely. So we think about, from a provider perspective, just what individuals in the healthcare industry are facing as folks are having to make the choice of, do I pay this very high deductible, or do I put food on the table or pay my light bill? Which means, again, that people are coming to the doctor when they don't have a choice often. And so that has to be tough on providers, having to jump into the highest level of care for individuals.
And what populations are most at risk right now? Is it rural, children, postpartum mothers, all of the above?
All the above, but I would definitely say it definitely our rural community. And, this is Arkansas. Sometimes living in Little Rock, we can think differently, but, the majority of our state is rural. And as you all know, we're losing hospitals. We're losing providers. There are stories about individuals living in rural Arkansas that are having to travel 45, 50 minutes to get to the doctor. And when we, just thinking about what we just discussed about preventive care, how likely are you to drive an hour, for a checkup when nothing is physically wrong with you at that time? There's some of us that will. But if you have barriers in terms of if your job will let you off, transportation, gas prices are high, all of the things really do lend to just making a practical decision not to do those things. And that's a problem that we need to try to fix.
So what should providers understand about the connection between economic policy and health, especially when it comes to poverty? Because that affects about 1 in 5 children here in Arkansas?
Absolutely. They should know again, and I think, Robin, we've talked about this. I worked for DHS for a long time, and, sometimes we would sit around the table and try to think about ways that we could make sure that individuals could access things like preventive care. But to your point about poverty is such such a crushing element for families to deal with, because you really are making decisions between things that you critically need. So, when individuals, when a woman is pregnant and she doesn't get prenatal care, it's not because she doesn't care about her child. If she is experiencing poverty, it's likely because she has these barriers that are preventing her from being able to routinely go and get the care that she needs. And so providers should be aware of that. And I know it's frustrating when they see folks who, have ignored preventive care or coming in, or, I've heard from obstetricians who are frustrated when they see women for the first time when they're 8 months pregnant. But most of the time, those women have a story as to why they're doing that. And it's not because they didn't want to get that care.
So looking ahead in the next, say, 13 years, what policy changes or trends are you watching most closely?
So definitely what we do pertaining to the safety net, and that is both in the state of Arkansas and federally. There's a lot of conversations about, our national debt. There's equally a lot of conversations here in Arkansas about, the amount of taxes that you pay, and we understand. I tell folks, our organization testifies always about to not cut taxes because we encourage investments to be made, but I fully understand why individuals don't want to pay their taxes. Not they don't want to pay their taxes, that's a crime, but equally why they don't want to pay as much, right? However, we really are at a place where if we're not looking to how we make sure that the safety net is sound, again, both in our state and in the nation, then we will have a lot of individuals slipping through that, and it will continue to have a negative impact on our state.
So let's talk positive.
Yeah.
What are there opportunities for Arkansas to improve outcomes in legislation or system redesign?
Yeah, so I think there's a number of things, and we can start with the things that we've already done. I always like to start with the fact that we don't have to reinvent the wheel. When Arkansas implemented our kids first, we were a leader. Other states did not have a program that was targeting children insurance. So we still have that program, but there are many parents that don't know that maybe they don't qualify for Medicaid, but their children do. And so we can start simple by saying, hey, look at the number of children that are uninsured. Let's have a focus on making sure those children are insured and they're going to the doctor. Like that's an easy first step. Pertaining to early childhood education, we used to be a leader in our investment in pre-K. Let's just sit around the table and again say, we haven't made an investment in pre-K in 5 to 6 years. Let's find the money for that and make that so that children can access. And that's just going to have a ripple effect in terms of positive.
So what are the risks if the current gaps like postpartum coverage, food access aren't addressed?
Yeah, back to, I would hate to see that happen, but we know, particularly as it relates to food access, Arkansas is already, we're number one for food insecurity. We don't really have any runway to get worse in that area, right? Meaning that if we're not looking at things in terms of, food access, then we could potentially be in a place where we're losing the few, the grocers that are there. I just had a conversation with a legislator about this. He was pointing out the fact that he lives in a very small town and he goes to their one grocery store, even though it's more expensive than going to Walmart, because he was like, Walmart is 50 minutes away. And there are people in his community that can only access this grocery store. Everyone can't make that decision to pay higher prices, but that shows that we're in a critical place when you're talking about towns that only have one place to buy food. And so I think that, pick an issue, whether it's food security, whether it's healthcare access, if we continue to see the safety net erode and we continue to see closures, be it a grocery store, be it a hospital unit, we are going to see just increasingly more negative impacts to our citizens. And a major point to that is that sick people, individuals that can't get access to care, equally don't work. So some individuals that are leaders in the state are often looking at economics and how can we grow our state economy. Well, you can if you have sick citizens. So that's equally a focus that we have to pay attention to.
And so anyone that wants to get involved with your organization, find out more, they can go to your website. How do they do that?
Yep, www.aradvocates.org. We would love for you to come to our website. You can see all the issues that we work on, but also please sign up for our alerts. I have to make a plug for that because we often send out emails throughout the year talking about these major changes that are happening. And then 2027, it'll be time for legislative session. It seems like we just had one, but it'll be time for that. And one of the things my organization does is we make sure that the folks that are following our newsletter knows what's happening at the Capitol. So we would love for folks to sign up.
Excellent. Well, thank you. Thanks for being here and talking about
Absolutely.
So many important things that are happening in our state, but good things ahead.
Good
Change
things
ahead.
Absolutely.
Thank you, Keesa.
All right. Thank you.
And that's it for this episode of AFMC TV. Have a great day, and thanks for watching.